lactation. During that time, the child starts putting his finger or the thumb. So that time, probably what happens is he might get into the habit of thumb sucking habit. Now, why the newborn infant does this is that is because it wants to feel a state of euphoria or for a sense of security, for the pleasure that it derives out of sucking, it gets into this particular habit. Now, sucking reflex, like I said, is usually seen at 29 weeks of intrauterine life, and it is the first coordinated neuromuscular activity. That is, the child gets its feeding or its nutritional needs are fulfilled by the sucking reflex that is there. Okay, that is the first coordinated neuromuscular activity that develops in an infant because it needs to fill its stomach, whenever it is hunger, that hunger needs to be satisfied. All right. So the purpose is nutritional gratification as well as emotional gratification because it is developing a sense of trust and bond with the mother. Now, only after that is, if you remember when we discussed the oral stages according to Freudian's theory, the first stage was the oral stage. If it is not satisfied, if the child is not breastfed properly, or if his hunger was not satisfied properly, that is when Freud says that probably the child is getting into the habit of thumb sucking or digit sucking or any other non-nutritive sucking habits. All right. So what is the prevalence from birth to 2 years of age? If at all the child is performing, we see it in around 67% of the cases. But as age advances, once the child gets into the school, once he gets in touch with the environment, a social environment he comes across friends, he comes across children of his own age group, all right, the incidence starts reducing. So at 2 to 5 years, we see only around 40% or around 20 to 40% of children performing. So about 10 years, it is reduced to as low as 10%. Okay. Now, these 10% children are the ones who are very adamant, who do not want to get rid of their habit, or probably they are having a psychological influence because of which they are into this particular habit. If you look at the incidence, again, the higher incidence is there in girls as compared to boys. But now the scenarios are changing. Boys have more incidence as compared to girls, okay, because of the emotional support that they need. Now, it could be, if you look at the types, it could be a single digit, like a thumb or a single finger. It could be 2 digits. It could be 4 digits, okay. You might come across a child who places all the 4 fingers, excluding the thumb in his mouth, all right. Now, the area of the placement can be, he can place it at the center, that is, through the central incisors, or he can place it towards the cheek area as well. Now, where he places the thumb also plays a role in determining what kind of malocclusions it is going to cause, okay. If you look at the classifications based on clinical observation, like, a child is walking into your dental clinic, he's putting his thumb and walking in, probably by that you can say that there is a normal thumb sucking, that is, he's not like, actually sucking, he's just placing the thumb in his mouth, all right. Only that you cannot see that actual perioral muscular contraction there, okay. Or there could be abnormal thumb sucking where the child may be having psychological problems, or it has become a habit. Now, according to O'Brien, that is, it was classified into nutritive sucking, that is breastfeeding, bottle feeding, and you have the non-nutritive sucking habits that could be thumb sucking, digit sucking, it can even be pacifier sucking, all right. Now, all these have one thing in common, that is sucking, that is, there is a perimuscular contraction which is happening, which is known to cause malocclusions, okay. Unlike breastfeeding, where it is not sucking but it is suckling process, it is a suckling process, whereas all other, that is your bottle feeding, pacifiers, thumb, all these are sucking, where the perioral musculature is exerting a lot of influence, okay. Now, this was one of the classifications which was given, where it is classified into level 1 to level 6, depending upon the age group, and whether this habit is performing during the waking hours, that is when the child is awake, or during the sleeping time. But normally what we see is when the child wants to go to sleep, he wants to develop that sense of security, So he places his thumb in his mouth and he goes to sleep. Now there are some kids, once they go to sleep, they suck the thumb so much that the mother who's sleeping or the parents who are sleeping adjacent can actually hear the sound of the sucking. But on the contrary, there are some kids who just place the thumb in the mouth and sleep, and when you remove it in the night time, they just sleep. But these children who suck their consistently suck their tongue, exerting a lot of force, it is where you remove the thumb, maybe another 5 minutes, they're going to place it back. And these children are the ones where you're going to see the development of malocclusions even at a very, very, very early age group. And these people, it is very difficult to, eliminate this particular habit. Now, this classification is very, very important because this helps us to identify whether that particular thumb sucking is going to cause a malocclusion or not.